Good morning and welcome back to the chat on News Day Amarillo and News Channel 10-2. I'm David Lovejoy.
I'm Chuckalicious, Chuck Williams.
And Alyssa stays with us this morning. She's with BSA Hospice of the Southwest. We were just talking about the FTD, dementia, and how that plays a role. She's here to join us and help us also talk about palliative care and understanding the difference between hospice and palliative care. And we did it on the auspice of the dementia and how to deal with these issues in life. Just real quick, break down to people. There's a difference between palliative care and hospice, right?
Yes, sir. There is a difference in palliative care and hospice. Palliative care treats people with chronic health conditions and terminal illnesses, but we're still curative seeking. Our patients are still seeing their oncologist, their cardiologist, even their primary care provider. Whenever we go into hospice, hospice is supportive care. So these patients have, of course, terminal disease with a life expectancy of about 6 months.
Whoa.
So palliative care, you can have a life expectancy of many years. And so that's the difference.
Let me ask you this. When we look at it, dementia, palliative care, they don't necessarily go hand in hand. Just because someone's suffering from Alzheimer's palliative care, that's not an avenue to hospice as of yet. There's other contributing factors.
No, no, sir. There's actually specific guidelines that we have to follow when someone has a diagnosis of dementia. Just because you have dementia, it does not mean you are hospice care appropriate. You have to have dementia plus other factors that make you hospice care appropriate. But a diagnosis of dementia is a palliative care diagnosis because dementia, unfortunately, is progressive, and we are there to help the patient and family support the symptoms that come with dementia.
So,
Go ahead, Chuck. Go ahead.
am I safe in saying that palliative care in this case is literally hospice for the living?
I have never heard it that way. Okay. So definitely palliative care is the bridge into hospice.
Okay.
A lot of times our patients start in palliative care as their disease progresses, we bridge into hospice.
Okay.
So whenever for example, my at FMC Palliative Care, we're under the umbrella of BSA Hospice of the Southwest. So our patients have an easy transition to go into hospice when that time comes.
Let me ask you this last question. This is always a tough subject for any
Yes.
family or anyone. Broaching this and having this conversation, what would you recommend? How are some approaches we could bring this on? And should we immediately be going to BSA of the Southwest to say, hey, I need a helping hand with this?
So let's start with palliative care. That is a chronic illness like cardiac disease, COPD, kidney failure, Alzheimer's. Any of those are progressive illnesses. So if going into palliative care can be at any time that you are diagnosed with one of these progressive illnesses. Now, to go into hospice, it's different. Going into hospice, we need to one, understand that we are going to leave curative seeking care and go into supportive care in the home. All care is given in the home. Also, by then, the family and the patient have decided they don't want to go back to the emergency room. They don't want to go back to the hospital. They want to be taken care of in their home only. They don't want to leave anymore. So that is where the beauty of hospice is, that they come into your home. Not only nurses, but practitioners, aides, social workers, spiritual care counselors. You have a whole team approach to not only be there supportive of the patient, but of also the family. That becomes very important.
You can reach out to BSA Hospice of the Southwest. They're located at 5211 Southwest 9th Avenue, Suite 100, or call them at 806-356-0026. Thank you so much for the great information in both segments. We really appreciate your
Yes.
help. And
Thank you.
for BSA Hospice of the Southwest.
Thank
We
you for having me.
here. We'll see you bright and early tomorrow morning right here on the chat.